Hey there, family. Well, good evening. Happy Tuesday. As always, I want to thank you for joining us for yet another Health and Humanity Fireside Chat. We have been so excited and having such an amazing time bringing these conversations to you every month. And this month is no exception. So, for those of you who may or may not know, my name is Pamela Price. I am Deputy Director of the Balm in Gilead and will be your host for this chat tonight. And as you all know, I can never do any of these by myself because I'd just be on here talking with y'all. And we like to make sure we're inviting people into this conversation, family, so that we can hopefully learn from one another, that we can hopefully hear something that will inspire us, that will encourage us, and really help us gain an even better understanding of when we think about health, what that means in the context of our humanity and our society, as well as in our communities. And so, without further ado, I am very, very, very excited for tonight's guest. She has been a friend of the Balm in Gilead. We have watched her in her efforts and in her work. And again, we're delighted that she said yes. And so I'm going to tell you just a little bit about her, but I'm really going to give her an opportunity to introduce herself to you, family, because again, we are excited that she gave us her yes. And so tonight's guest for our July Fireside Chat, where we're going to be focusing on looking at how policy shapes our mental health and really thinking about that again from the context of our community. We are honored to have the Reverend CeCe Jones-Davis. So Reverend CeCe is an award-winning faith leader. She's a public speaker. She's an impact strategist. And she, much like the Balm in Gilead, works at the intersection of faith, social justices, working to empower our communities. And it's a whole lot more. She has been an activist from HIV/AIDS to death penalty work to menstrual equity, like you name it. If it's something that is impacting our communities and we need to know about it, and more importantly, those who are in positions of leadership or decision making know about it. And so please help me welcome Reverend CeCe Jones-Davis as the guest tonight, family.
Hey, Pam. Listen, you gave me such a warm and incredible intro. I really appreciate it. I'm so glad to be with you tonight. Thank you so much. When I got your email, I was like, are they really asking me? Because I have been, I won't say a fan. I've been a disciple of the Balm in Gilead for so many years. And when I first came into ministry, years and years ago, and I wanted to figure out how I would fit into unconventional ministry, you all gave me a model. So I can't even, I know I'm talking a whole lot already, but I just wanted to say thank you for having me and how excited and honored I am to really be here. Thank you. And in that, let me also honor you all's director, Dr. Pernessa Seal, who's been such an example. I've never met her, but she's been such an example for me. And so I'm really grateful.
No, thank you. We'll make sure to share that with her. We kicked this series off for those of you who may have missed it. We kicked this series off with her. I had an opportunity, even as deputy director, to talk with her and get her perspective. Our CEO turned 70 years this past year, and we all celebrated that. But she's been in this space, doing this work, in this fight, so to speak, for almost 4 decades now. And so it was so awesome kicking this series off with her. So if you guys have not had a chance to go back and watch that, please make sure that you go and check that out. It's on YouTube. If you can't find it, just send us an email and we'll make sure that we get it to you, because that really, I think all of that ties into all the conversations that we've had up to this point. And I'm sure it'll resonate even in what you and I will be talking about tonight. And so just as a reminder, family, please make sure that you can let us know where you're joining us from, and whatever platform you're watching on, let us know where you're joining us from. If you have questions, if you have comments, please make sure that you put those in there, and anything that we can maybe see and that we have a chance and time to be able to lift up, we will. Because again, this is Really, again, just an opportunity for us to hear from, leaders like Reverend CeCe, and to hopefully, when it's all said and done, what we all want when this whole hour tonight is over, is that you felt you have now something, at least one thing that you can take and do as we move forward, as we think again about our health and our humanity. And
Mm.
I see somebody from Texas, and yes, I'm biased. I'm going to admit that, and I recognize my own bias. I'm from Texas, Texas girl through and through. So, hey there, Miss Judy. Yeah, Wild Tubbs from Texas. What's up? Um, Sorry. I love everyone else too, but when I see Texas, I get a little excited to see some of people. Um, but we like to kick each one off, Reverend CeCe, with just having, because again, your bio is amazing. You guys can Google her; she is Googleable. If it's a word. Um, but we like to really have the guests share their why. Like,
Mm.
you've been doing this work a long time.
Mhm.
Like, what is your why for doing the work that you do, staying in the fights, and being in these spaces that sometimes can be really challenging to be in? So tell us a little bit about your why.
Yeah, that's an awesome question, and it's a loaded question as well. I would start with the kind of like the bottom line up front. My why is because I feel tremendously called to speak up for those who could not speak for themselves, or to amplify those whose voices would otherwise go unheard, who need to be heard. I feel very called and compelled to, to advocate and to be a friend to those who are marginalized. So that's the bottom line as to my why. But I would also say that I have been cultivated in the work that I currently do. I've had a really strong example coming from a very small town in Virginia, close knit community, close knit family. I had really strong examples of particularly Black women who knew how to show up for people, knew how to show up for their neighbors. My grandmother, who wouldn't have called herself an activist, but would have called herself more like a missionary.
Yeah.
A mother who would have done the same, would not have called herself an activist necessarily, but she is the one who's knocking down somebody's door when a neighbor's house has burned down and they need furniture. So those women have really from an early age really cultivated that gift of taking care and noticing the vulnerable, right? And speaking up. I come from a family of women who have great oratory skills. My grandmother was an amazing public speaker. And so I even think that has a lot to do with it. When you have particular gifts, she showed and taught me, when you have particular gifts, you are to show up with those gifts for other people.
Wow.
And so I would say that has a lot to do with my why. Um, I would also say that God has really just kind of put me on a course from the beginning of my life, I would say, to not only have the examples of my mother and my grandmother and others, but also to have educational experiences at Howard University, which really helped me to understand not just Black excellence, but also Black issues, right? That experience opened my eyes. I went to seminary at Yale. That was another experience that really opened my eyes in a lot of ways. First of all, that experience gave me an opportunity to think outside the box as someone who felt called to ministry, and to explore what that meant for me and what that could look like for me outside of the four walls of the church.
Yeah.
It also introduced me. So I was in Connecticut, and it introduced me to people like Reverend Nancy Kingwood, which many folk out there will know, who is, I mean, the baddest of the bad in Bridgeport, Connecticut at GBAP, and has been on the battlefield
Yeah.
for so long, and has really mentored me in so many ways. in
Wow.
HIV/AIDS work and faith work and all kinds of things. So along the way, I say all that to say, God has put people in my path that have helped form
Mm,
me,
yeah.
right? And He does, I believe that God does that for all of us if we're
Right.
open to it. He'll put folks in our path that will help form us, right?
Right.
Shape us toward the destiny that we're created for. And so my why is because God called me, but there
Yeah.
were there were Black women in particular who
Right.
put their hands on me or who put their hands on my spirit in some way and
Right.
really formed and fashioned me. um,
Mhm.
have the heart and the spirit and the wisdom, the intellect that I needed to do the work that I was called to do.
Ooh, wow. That really resonated with me, like in so many different ways. And so thank you so much for sharing that. And like family, I hope again that throughout this entire conversation that you find many things that you'll be able to take away with you. Like, it's always important, I think, for me and the work that I do, the work that the Balm and Gilead does, that we think about legacies. We think about who are we touching, who are we pouring in our knowledge, pouring in our wisdom, sharing our experiences with, to
Yeah,
kind of build up this next generation. Like if we keep looking back and wondering who is next, right? Who is going to be the next, whatever. Sometimes it's just a question of us looking around. Like that person may already be in the room. That may already be, a young woman or a young man that that you know we need to touch, we need to to stop and take that moment and put that time and that energy into, like all the women who have done that for you. And so I think that's just so important. And sometimes I think even definitely now more than ever, we don't maybe have, our village looks a little different, right? Or maybe isn't as big as what it used to be. So thank you so much
mhm.
for sharing that. And I know I saw a few people from Connecticut in the chat. So Connecticut is in the building as well. I
Awesome.
think Georgia also. So thank y'all again for being with us tonight. Um, so we're gonna just dive right in, family. We all know that we are still dealing and probably processing for some of us the passage. Uh, well, I'm gonna start back even before the passage of this bill that just got passed.
Yeah.
Many of us can take this all the way back to November, previous November, if we were folks who were out in our communities, trying to educate people and get people ready or register to vote. Like, again, those of us who have been in this space know it wasn't just what happened with the passage of this bill, but there was a lot of things that have been leading up to it. We've seen these shifts in how legislation happens. We've seen this shift in legislation that seems to have less and less humanity in it, that seems to not really center people, but centers, these, other things. And so, but we do know that there was the passage of uh, um, what they called a big, beautiful bill. What I consider to be beautiful is clearly not what they think. Um, that as it's going to get to be implemented, it is going to create some significant challenges and hurdles in our communities, um, from healthcare to economics and everything. And I would love, again, just as someone who I know that you also are in these space and a strong advocate when it comes to policy. What are some of your thoughts on just where we are if we think about this kind of legislative landscape that we're in right now? And then even thinking about what kind of mental health toll is it taking or has it taken, on our communities up to this point?
Yeah, absolutely. We policy wise, we are in a cruel place. I did a lot of advocacy work with organizations like the Black Church PAC and the State of the People a couple of weeks ago before this big ugly bill got passed, really trying to help people understand some of the ways in which this bill is going to harm, right?
Um,
of the most vulnerable communities. And it's a huge document. I think it's a huge document for a lot of reasons. But one of the reasons I think is to deter folk from knowing what's in it,
Right.
right? And
It's
I think
887 pages.
yeah, exactly. And we know that, of course, and it involves a lot of budget added to
Mhm.
Department of Defense and cuts to education and things like that. I
Mhm.
think some of the things that are really, really bothersome to me have to do with the cuts to people's health care,
Mm.
and the cuts to people having access to food. Those
Yes.
those are the two things that really, really, really get up under my skin. When we think about the numbers of people in this country who go to jobs every day and are on Medicaid,
Right.
um, whose Medicaid is about to be cut or severely diminished.
Mhm.
When we think about Medicaid, I think that a lot of folks who are empowered to make these kinds of stupid decisions,
Right.
I think they have a stereotype around like what Medicaid and food assistance is and who that is.
Right.
The black single mother stereotype. I think
Yeah.
that's probably what they're thinking. What they don't realize they have done, they don't realize they have harmed veterans in this country. Where we
Right.
have at least 1.25 million veterans who rely on Medicaid. Right.
Yep.
We know we already have a terrible, a whacked out veterans a VA system, right?
Right.
And now you take that money away from veterans who have fought for this country.
Right.
We know that millions of veterans are also have access to SNAP, food
Yep.
stamps, and food programs in this country. And so it is there are cruel policies that I believe are really driven by racism.
Yeah.
And,
100%.
and what they don't understand is that they are cutting off their nose to spite their face, which some my grandma would say. When we consider the amount of older people, and when
Yeah.
I say older people, I know we had to be careful with terminology, but where I'm from, old folks are sacred.
Right.
Older people are held up in high esteem. And when I think about the fact that benefits are being taken away for their doctor's appointments, their hospital stays, their wheelchairs, their oxygen tanks,
Yep.
and all the things that come along with getting older, right,
Yeah.
and getting assistance. That deeply, deeply concerns me when I think about the numbers of children in this country. Feeding for America has a statistic that says that 100% of counties in the United States
Mhm.
have hungry people.
Yes.
100% of counties. And
Yes.
so when you think about food assistance programs being cut,
Yeah.
what could that possibly mean?
Yeah.
And so, I think policy, so I'm close to DC. We did a lot of, engagement on the Hill at the Capitol with Reverend Warnock and so many others trying
Mhm.
to fight against this bill. And unfortunately, it got passed. And I'm deeply concerned, but I'm most concerned about the cruelty of our systems and the
Yeah.
cruelty of our policies, the cruelty of our policymakers. And I'm really concerned about how that's going to cost us
Yeah.
in terms of human life.
Yeah.
Yeah.
So, and again, this is and for those of you who, again, if you followed the Bob McGillett, or you've paid attention again to just conversations that we have, you maybe attended some of the roadmaps that we had this year, you'll know that we have been exceptionally adamant in keeping our ear to the ground in terms of policy work. That's everything from when we were looking at, changes to the 340B program, which is another very important federal program that helps individuals get access and afford medications that they need. Legislation that, looks at increasing access to genetic testing, the legislation that we need to help caregivers and get paid leave. Like, all of these things have been so important, but to, like, your point, there's a level of cruelty now. Like before, it was a little, felt like at least a little bit more common sense was taken. You know, they were listening to the subject matter experts. You know, they were listening to our medical associations, and listening to those who are saying this will be catastrophic. People will die. Like we
Yeah,
have had those who have been brave enough to come out against this ugly bill and to paint quite a devastating picture. And like, even if we think now July is Minority Mental Health Month, there are those same cuts that you mentioned that are going to be stripping away access to healthcare programs. That's going to also impact people's actual access to a mental health care professional.
right.
It's going to, we worked really hard since the murder of George Floyd, right, to really look at how police are used when there's a mental health crisis that a family is dealing with. Well,
Right.
those crisis intervention services are going to be impacted as well,
Uh,
because when states have to now decide we are no longer getting access to the Medicaid dollars and other funding that this bill just completely guts, they now at the state level have to make some really hard decisions. You mentioned veterans here, so I am a veteran. My husband is a veteran.
mhm.
Um, and, here in Virginia, we know that there's roughly, I think, over 300 something thousand veterans that we know, as passage of this bill, are going to lose access to benefits that they actually, need. And I'm like, we're talking about people who have given their all to
That's right.
this country.
That's
And to have that happen, is, like you said, it's cruel, it's inhumane. And I think while we can definitely take a minute, I think, to process and probably even grieve. Like sometimes it feels like it's a grieving that we have to go through, or that we are going through, because it feels like such a loss to things that you would think would be just fundamental, rights. Who doesn't want to feed children?
who,
Mm,
who,
who,
who.
what, how, what, again, you think, like, what kind of human being is okay with children going hungry? There is roughly $7 billion being held up that was already appropriated to our schools. So, as I want y'all to think about it, a lot of places will start going back to school August, September. There are school districts now who don't know whether or not those funds are ever going to get released, and they need to make decisions on their food service programs.
That's
And
right.
those are meals that kids, that breakfast and that lunch that some of our children are getting at school, those are the only meals that they will get.
That's right. And we also have to consider that, you know, summer programs,
Right.
meals that sometimes are provided to kids over the summer months, because we know statistically that there are some kids who don't eat well over the
Right.
summertime,
Yeah.
right? Those meals are being cut. So I really think we are in a nighttime season. I really do.
Yeah.
Um, we're in a cold space,
Yeah.
and the only appropriate thing for us to do is to grieve. The
Yeah.
only appropriate thing for us to do is to lament. You know,
Mhm.
as people, sometimes we are always trying to look on the bright side of things, and we're always trying to avoid the hard things. But like, this is the time to cry loud and spare not. People's
Yeah.
lives are on the line, and we ought to be grieving, and we ought
Mhm.
to be lamenting, we ought to be crying out, and we ought to be acting, and we ought to be
Right.
lifting up our voice and not feeling like it doesn't matter, because it still matters.
Yes.
We still have responsibilities. We
Yes.
still have moral responsibilities to use our voices to say the right things and our hands to do the right things. And so I just really want to encourage folks out there. We're in a tough spot, but this is not a spot that many of our folks, our ancestors, have not seen before. And we have the script in our DNA. We
Yeah.
have to just continue to pursue. We have to continue to survive hard moments. We have to continue to be innovative. We
Mm.
have to continue to be prayerful, and we have to continue looking out for one another like we never have, maybe in my lifetime before. Really looking out for people. How are you doing? Do you have food? Do you have what you need? Do you need a ride? I mean, we have to show up with empathy in a way that maybe a lot of us are not accustomed to, but
Yeah.
we're going to have to look and see with brand new eyes in a season like this. And you did say, Pam, you mentioned mental health. I've done a lot of work over the last year talking to people around the country, particularly people of faith, about structural racism and health disparities and the toll of mental health. And I can tell you that in every setting,
Mm.
and I've met with over 100 people, in every setting, people are talking about mental health, and they're
Yeah.
talking about this. Pastors, faith leaders are talking about how can we better address this
Yeah.
huge thing of mental health that we are seeing as a problem in our communities more and more and more. Why? Because people are stressed out. I remember talking to some folks in New Jersey, a Haitian pastor,
Mm.
and his congregants, mostly mainly from Haiti, not showing up to work for fear of ICE, right?
Right.
For fear of ICE raids. So they're not showing up to their jobs,
Mm.
uh, and they're showing up to the emergency room because of high blood pressure and
Yeah.
panic attacks and heart palpitations and things like that. People are enormously
Yeah.
stressed.
Yes.
And we need more mental health services and mechanisms, not less. We need
Yes.
more research, more resources in a time like this, and not less. And so that mental health piece is a lot. And
Hmm.
I mean, even when you think, Pam, the things that you and I are just scrolling through our phones every day, seeing, and not just
Yeah.
in America, but all over the world.
Yeah.
Talking about Israel and Gaza. We're talking about the impact of PEPFAR being
Yeah.
talking about USAID, the sweetest little organization we got in the United States,
Yeah.
closing down HIV/AIDS services around the world, which is going to lead to the death of hundreds of thousands of people.
Yes.
So the mental anguish of the things that we are watching every day.
Right.
There is a word for this.
Mm.
And I came across it maybe a couple months ago, and the
Mm.
word is moral injury.
Yes.
Moral injury occurs when we keep seeing these devastating things over and over and over again, but we do not have a capacity to fix it. We
Right.
don't have a capacity to stop it. We don't have the capacity to stop the bombs. We don't have the capacity to reopen the HIV/AIDS services.
Yeah.
There is a injury to our innermost place,
Yeah.
um, that can really, really bring in despair. And so that mental health piece is something we have to keep lifting up and talking
Right.
about in a cold season like this.
No, I could not agree with you more. And if you think about just before, like before it kind of got to this place, our communities were already gripping with stigmas and just misunderstanding or lack of understanding when we think about mental health and what that means across that entire continuum.
Yep.
And now you add on to it, like you said, there are so many things that many of us feel these are just happening to us. And there is not even a recourse or not a timely recourse for me to even be able, like you said, to find some kind of way to address it. And that's why, again, family conversations like tonight are so important to me. I know they're important to Reverend CeCe, and they're important to the Bomb at Gilead because it at least this is a safe space. This is a safe space for us to acknowledge what we are feeling, to acknowledge the trauma that has been done, the trauma that is being done, and how we can hopefully lessen trauma in the future when it comes to all these different things, whether it's legislation and policies or again, loss of access to services and benefits and things that we need just to be able to live. We're not even talking about live a quality life. This is just us to live, to eat, sleep, and breathe at this point. And it's important because, we're also, collectively, I think, like you, and you said it, as a people, we are, our DNA, we're wired a little different. Our ancestors have given us things and
Yeah.
tools and a blueprint, even in many cases, of
Yeah.
how time and time again, when we built something, when we have established our norms and established businesses, and we've established cities and these structures, established our own institutions, even in this country, and we've had to do that many a time. And this is this is different and also the same.
Right.
In terms of, like you said, they're cutting their nose to spite their face, for sure.
Yeah.
But we will be while we know that we do not account for the majority of people on Medicaid, Black people do not account for the majority of people receiving SNAP and or social service benefits.
No,
We are the face of many things, not those.
not those.
However, when we lose them, our avenues to be able to make up and pick up that slack, we don't have.
That's right.
Right? So we don't have some of the other tangible assets that some other individuals may be able to have to tap into. We don't have, if we don't have a place or lose access to put a loved one who's in a nursing home facility, and now you've lost, the ability to put them there. We don't have 4 or 5, 6 bedroom homes that, we don't have money to modify a home so that your loved one
You
can
got to go to work.
Right, exactly.
Everybody in our house has to go to work.
Has to go to work. So no one can stay home and, and watch, for free, and so, yeah, so we are, while maybe not the face of something, it's just that when it hits us, it's 100 times fold more devastating, right?
Right.
And so I love that. Yes, we're being able to recognize that, and then I think you even started to kind of segue us to it in terms of thinking. And I love that you continue to have these conversations with faith leaders. You engage with them, on a regular, routine, and consistent basis. And so, you kind of touched on in terms of like these challenges that our faith leaders are already seeing when we think about mental health. But what are some of the things that you're hearing in terms of possible solutions that they're thinking about? Like how do they think we could be able to even begin to change those narratives that we see when we think about mental health?
Yeah. What I have heard a lot in that regard is pastors understanding what their limitations are, faith leaders understanding what their personal limit and professional limitations are, and really seeing the need to partner with folk in their congregations who may be professional, medical folks, partner with local organizations that can come in and assist. And what they're saying they need is partner with organizations also that they can refer out, because pastor can pray for you, and some of them are qualified to do a little counseling here and there. Yeah. But I'm really grateful to hear more and more faith leaders understanding that they cannot carry all of the weight and that they have got to resource out, right? Yes. And so what I'm really encouraged to hear is so many people open to networking and building broader communities and using the resources that are right there in their pulpits, right? But what they're saying they need is education. That they, as the faith leaders and lay leaders themselves, they need education, but then their congregations need education as well in terms of addressing stigma, mental health stigma, addressing mental health care, what is available for people, what are the signs, what are the these sorts of things, right? What are the resources that you have in the community to refer people to therapy, or
Right.
to even address, as a part of that stigma, address the stigma attached specifically to therapy,
Yeah.
right? And to push the message that we need Jesus and a therapist,
Right.
um, and so those are the things that I am hearing a lot, when it comes to mental health, in communities, and how folks and leaders are grappling with
Mm-hmm.
these issues. They know that they've got massive issues,
Yeah.
problems in their communities, and they know what their limitations are. Hey,
Okay.
I can take you but so far, but then
Yeah.
I'm gonna pass you on over to Dr. Price to help you figure this out a little bit further, right?
Yeah.
That's encouraging to me. That's encouraging because
Yes, it is.
yeah, because there was a time, and we still see that, y'all, sometime, where we are just trying to pray something away, where we are saying, well, if you're depressed, you just don't have enough faith, you know,
Right.
all these sorts of things, instead of dealing with mental illness as illness.
Yeah.
And so, I'm really encouraged
Yes.
by what
That's
I'm.
a lot.
Yeah.
Yeah, and you said it like I know so as someone who lives, with a mental illness, like I think yes, I've met some of that, and it's nice to now see the shift, where yes, I agree. Yes,
Right, Dr.
exactly.
Bill.
Dr. Seal is saying yes, we need Jesus and the therapist. I
Yes,
can second that or third that. I have Jesus and I also have an amazing
me
therapist.
too. Me too.
So, but like I love that in your conversations with our faith leaders, you are seeing this shift of them acknowledging, yes, this is an issue. And no, we don't have everything to fix it, nor do we have to. Like you said, we just got to figure out how we're going to build the infrastructure. How can we build the system that can really support not just the people in this congregation, but the people even beyond, the walls of our church. And I love, 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 love that.
Mhm.
And like for anyone who's like watching and join us, I'm going to challenge all of us to think about, you know, do you know community-based organizations or other faith-based organizations who are doing mental health work in your area? Do you know who's providing mental health first aid in your community? And
Mm.
how can you support them? Mental health first aid is a nationally recognized program, that in many, many places you can actually find training that's done through, let's say, maybe a health department or another local community mental health organization, and they'll provide it to you for free.
Yeah.
That training, again, that could be a tool if you want to take that to your pastor to say, hey, pastor, I went and got this mental health first aid training, and now I can, you can be a source, or resource to your pastor and to, again, those within your network. So, because it's going to take all of us.
It is. And Pam, I'm so glad that you said that, because, some of us need to take more initiatives within our communities. We might be the answer that folks are searching for. So let's take initiative. If you have a resource, if you are a resource, if you know of a resource, tell everybody, say
Mhm.
something, tell your pastor, because they might be up on that pulpit looking like they have it all together. But trust and believe, sometimes they're shaking in their boots, because there are so many issues and challenges, right? And
Right,
and no one person has all the answer. And so
right.
take initiative, lean in, be a lay leader, uh,
Yes.
where you are, because what you have might be the answer to somebody's problem.
Yes, I love that. Again, we can be the answer. Like you hear like people say that things like be the change you want to see, but that is very true. Sometimes it's not us sitting around waiting and saying who is going to do that, but no, I can do that. It's the same thing when we think about policy and legislation. You do not have to ask for permission to reach out to your local, elected officials. Like, technically, even though they seem to have forgotten it, they really are supposed to work for you. Like,
100%.
they have offices, they have staff. Like, call them, email them, show up.
That's right.
Um,
And I'm so glad you said that too, because The advocacy part, I think the policy advocacy part of a lot of this can be really intimidating to a lot of folks. Right?
Mm-hmm.
When you think about, Capitol Hill in Washington, D.C., you can't get in. How do you get in? How do you get on the phone with these people? We definitely need to provide more trainings and resources for our coalitions and our communities and
Mm-hmm.
individuals to know that this is how you figure out who your member is. This
Right.
this is this is where you go to find their telephone number. This
Mm-hmm.
is how you click on that link to send them an email. You
Right.
know, and then pass it on. Tell 5 people
Yes.
in your family to do the same. Sometimes um, we feel like advocacy is this really, really big thing
Yeah.
that everybody can't do, right?
Yeah.
But everybody can do something. If
Yes.
it's a phone call, if it's an email, if it's a Instagram or Facebook where you tag, because that's what we did a lot in the last couple of weeks with those folks who needed to change their minds around that big ugly bill. We
Yeah.
were shaming them to death. we
Yes.
we we were tagging them, and tagging their
Put their pictures up, like.
offices up, putting the statistics up. Like, don't you know that 51,000 people are slated to die because of cuts in Medicaid every year? And tag, tag, tag. There's so
Yes.
many different ways to advocate. And I think we need to make advocacy a lot more accessible
Yes.
to everybody and not just a few folk who've kind of learned the ropes or
Yes.
got trained by a lobbyist or something like that. Like every little action, whether
Yeah.
it's signing a petition or sending
Right.
an email, all of that stuff matters.
100%. Could
Yeah,
not agree with you more. Some really, really good friends of ours were talking again just about advocacy, right? And what that means, whether we're talking about advocacy and policy. And I loved that the way they had us kind of look at it is that advocacy is both a self advocacy. Like you're never going to find someone who's going to be a better advocate for you than yourself. So
hmm,
even if you start with the self advocacy of, well, what is it that I am in need of, or what is it that I am not getting? That could be that you're not getting it from your local elected officials, could be you're not getting it from your healthcare provider and whom you're seeing to get care, could be that you're not getting it from your child's teacher, right? And so there's that level of advocacy. And then when we think like, okay, I've learned now to maybe be an advocate for me, how can I take it up another notch and say, okay, now can I be an advocate for someone else? So someone who may be dealing with something, struggling with some type of issue or challenge that
yeah,
maybe you've come through, right? And so now can you step in and, stand in the gap for them, so to speak? Can you intercede for those of us, in the faith space? Intercession is advocacy. It's
100%,
prayer, but that's advocacy. And
100%.
then if we can do that, then now we can be the advocates in our community. Now we can, like you said, we can be the one to say, maybe you start a letter writing campaign to your school board or to your city council. There's so many different levels to our government and our policy structures that we keep thinking everything is happening out of DC, and we're forgetting what's happening right in your backyard.
That's
Like,
right.
and I want to challenge you again as we move forward. This ugly bill has passed. It's done. We can't go back. That cannot be undone. Yes, we know we have midterms coming in 2026, but there are many, many, many elections happening before we get to 2026. A lot of those are local.
That's
So, again, find out, are there elections happening where you are? Find out who are all of your elected officials. That's everyone in your courts, schools, cities, and state. And then get a game plan for how you think. And again, it can be small, like you were saying. It could be you send an email. It could be maybe your first step is just collecting that information, right?
right.
Having that so that and then when you feel like, okay, I can do something with it, now I can take some steps.
That's right. Research.
Yep.
And we have no excuse these days. We have So much information right here at our fingertips, right here in our phones, to figure out, who's running, who's currently in office,
Yeah.
what have they done while they've been in office, what
Yeah.
kind of platforms are folks running on now,
Yeah.
what are the issues that they're already raising up, what are they promising to do, those
Yeah.
kinds of things, and see how those things are lining up so far with your values, right?
Yeah.
And then make sure that you're making a conscious effort to move your vote and the votes of those people that you know and love, in the direction of your values,
Yeah.
right? um Absolutely. And I love what you said about advocacy. I always define advocacy as allowing other people's stories to live in you.
Mm.
And I did, as you mentioned earlier, some death penalty work. I led the Justice for Julius campaign in Oklahoma, and he was on death row for many, many years. Long story short, came within 4 hours of his losing his life before the execution was stopped. But when we take on really big issues and big challenges,
Yeah.
we have to allow these people's stories to live in us.
Yeah.
Just as if I was on death row, or as if my child was on death row. You have to allow this stuff to live in you so that you can properly advocate. That's how you know that it's that's where the power comes from. When it's
Right.
real in you, that's where the power comes from to be effective.
No, absolutely. Absolutely. I could not agree with you more. And I want to give a shout out. Thank you for all of you who are putting in the chat, either work that, sharing that you do work in the mental health space. I am loving seeing that several of you actually are putting this work in your actual churches, offering trainings. I see that someone also has like a therapy room.
Mhm.
And and that's what we need again. And let's say maybe you're someone and it's not in your church, but you have that skill set. You're a licensed therapist. You're just already trained in mental health first aid. Again, reach out to your faith leaders, reach out to your church leaders, reach out to, again, those within your network if you want to explore opportunities, again, to put that to use. Sometimes we keep looking for tables to be at, not realizing we have everything that we need to build our own table.
Mm.
And so it sounds like some folks are building their tables, and I commend you
Amen.
and thank you for that. And so before we go, because we want to now we know where we are. We maybe even grieve some more. But now, before we go, I want you, again, just in your perspective, with your experiences and stuff that you had, what would be 2 or 3 things that you kind of call to action wise that you would have for our communities to really position themselves to be able to address these challenges, whether that be in different partnerships or relationships that we should be thinking about as we move forward?
Mm-hmm. Very good. First of all, I would say that even in this hour of such grief and lament, one of the very first things that we need to center is our healing. Um, because people can die of a broken heart, and there's enough out here to break our hearts on a regular basis. And so, just from a pastoral care perspective, I really recommend that we find our healing circles.
Mm.
That can look a variety of ways for different people, but making sure that we are doing what we can to take care of ourselves, to guard our hearts, to protect our spirits, right? Because it, you know, we're trying to walk through a very, very hard time, and at the same time not allow the that hardness and that coldness and that cruelty get inside of us.
Yeah.
So I would say that's really important. I would also say it's really important for us to stay connected right now. That isolation is really dangerous. I really encourage folks to follow Black Church Pack. You can go to blackchurchpack. I believe it's org, to sign up. They do weekly or bi-weekly events, bi-monthly events, where we bring folk together for conversations about what is happening, answer people's questions, have topic experts to kind of go through things. So being in community and staying connected to good information, I think is really, really important. So that we can even continue to equip each other. And then a word that I used earlier, which is partnerships.
Yeah.
In that connection, what can we identify as something we don't know or our community doesn't know or need to grow in, and who's out there that we can connect with um, that can make us stronger and we can make them stronger. So I think making sure that we are being intentional, making sure that we're being intentional about intersectionality, that our little world doesn't have all the answers. We need to make sure that we are um, pollinating as much as possible, because they got some answers over that way that you don't have over here. And so we need to make sure that we are partnering well and that we're working smarter and not harder.
I love that with the cross pollinating, because like you said, if we keep regurgitating the same information and or sometimes the same misinformation, we never move out of that same spot. We're just all like running around. It's like that hamster on the wheel, and so you can't come out of that wheel unless you're willing to go see what someone else is doing, or
Right.
what's happening elsewhere. So I definitely love that. So again, we have just a few more minutes, and so I definitely want to just acquiesce if there's anything else that you would love to share, with us, even just letting people know how they can connect with you and the work that you do.
Well, first I just want to again say how excited I am to be with you, Pam, and to be here with Balm and Gilead. Again, you all have been have really shaped me over the years and my ministry over the years. So I have to just honor that as much as I can tonight. Folks can find me on Facebook, CeCe Jones-Davis. People can find me on Instagram, CeCe Jones-Davis, no hyphen, just Jones-Davis, CeCe Jones-Davis. Would love to help you, to welcome you into my community. I do a lot of ranting and raving on social media, because there's a lot to rant and rave about, and it's where I get my stress out. But there's a lot to talk about. I feel really called to make sure that I'm using my platforms to talk about things that are much more important than just little old me. And so if you want to know about the current events and you want to hear somebody rant and rave about them, going over to my page and you'll see that. But you'll also get, hopefully tap into some hope, because we still need hope, and we still need joy, right? Joy is a form of resistance, and so we still need that. Folks can go to my website, cecejonesdavis.com, and I just really want to encourage people to to tap into joy. This is a hard time. This is going to be hard, considering the bill that just passed, right? But again, be committed to being good to your neighbor.
Yeah.
Be committed to being kind like you've never been kind before. I mean, going out your way like you've never gone out your way. I grew up knowing people who had very little, but some kind of way, they always went out their way to make sure other people had what they needed.
Yeah.
So we've got to get back to those kind of roots again. My grandmother used to have people coming over to her house when we would pick our garden to help her can. And those ladies would be in the kitchen canning all day, and then when it was time to pick their garden, my grandma and all of us were loading up in the car, going to their house to can their food. And so we have to be really intentional about community again.
Yeah.
Right. And doing things because they are right, not because we're going to get something out of it, but because they're right.
Yes.
And I would call that, from where I'm from and my life experience, just getting back to the basics.
Yeah.
Getting back to the basics of humanity.
Yes.
I think we have to be very, very serious about that right now.
Wow. Well, family, look, I can't think of a better way than to end it on that note because that is what this is about, health and humanity. And we have to return to that. So, again, I can't thank you enough. I know I definitely enjoy the rants. I think we all need to find that safe space sometimes where we can rant a little, a little bit. So I appreciate it. I encourage you again. Please make sure that you connect with Reverend CeCe. I promise you will not be disappointed, and want to thank everyone who joined us on tonight for our conversation. Again, and if you missed any, please go back and watch them. We started these off in April. So you've got April, you've got May, you've got June, and now you have July. And then make sure that you also share this as well. And then we will be continuing this conversation again next month, family. So again, make sure that you register, you share it with a friend. And just two announcements tonight. Um, we are excited to share that the Bomb and Gilly continues to be on the road. So we just wrapped our third annual Healthy Churches Roadmap Tour, had an amazing event in Baltimore, and now we are headed and continue on the road again as we are working to elevate our health agenda. And we will be in Nashville, Tennessee at First Baptist Church, Capitol Hill, where we're going to have our amazing friend, Dr. Craig Cole, talking about multiple myeloma and cell therapy. Please make sure if you are in that area that you will avail yourself. This event is free, and it will be immediately following that Sunday service on August the 10th at noon. And happy to have our friends at Bristol Myers Squibb support this event. And then last but certainly not least, registration for this year's Healthy Churches 2030 National Conference, virtual again, is now officially open, family. So this year's conference, November 17th through the 19th, is open. If you've ever experienced a Healthy Churches, whether in person or virtual, you know we got something for everybody. So make sure that you take advantage of registration while it's open now. We have early bird. So early bird right now is just $25, but early bird will end on August the 31st. So don't delay. Again, go ahead and get your tickets now for what we know is going to be an amazing, amazing experience. And so we don't want you to miss it, family. So please make sure that you go and register today. And as always, again, just thank you so much, Reverend CeCe, for joining us. Thank you all for tuning in and watching and engaging with us and dropping all the amazing information that we saw in the chat. Continue to do that even after tonight, and continue as you all move forward in your own networks. And as our visionary leader and CEO would remind us all, that no matter what is happening in our lives right now, what is happening in our communities, there is a balm in Gilead.
Amen.
Thank y'all. Good night.
Good night.